नमस्ते म डॉक्टर सप्तर्षि घोष म एकजना क्लिनिकल कन्सल्टेन्ट oncologist from Hope and Hill Cancer Hospital and Research Center, जोटियाकाली मोड, फुलबारी इन सिलिगुडी. सो आज हामी चाहिँ अलिकति गल ब्ल्याडर क्यान्सर्सको बारेमा भन्छु. सो गल ब्ल्याडर क्यान्सर मिन्स पित्तथैलीको क्यान्सर. सो दिस इज अ भेरी रेयर क्यान्सर अल ओभर द वर्ल्ड, तर अनफर्चुनेटली इन आवर पार्ट एन्ड इन द ग्यान्जेटिक बेल्ट द gallstones एकदमै धेरै कमन छ. So gallstone, when it's neglected, when it's a long standing history is there of gallstone disease, त्यसपछि चाहिँ gallbladder cancer को formation को chances बढ्छ. So there is an association with gallstone with gallbladder cancers, but it's not always causative, but there is an association. So त्यही भएर there is a huge incidence of gallbladder cancers in our region. Almost every day we meet some young gentleman or some lady with some gallbladder cancers, and it's a terrible disease to deal with. Most of the, unfortunately, gallbladder cancers ekdam silent khalko disease huncha. So alikati pain huncha. The pain is the most important sign, and sometimes patient like vomiting feeling huncha, nauseating feeling huncha, and kaile advanced stages ma jaundice haru dekhincha हैन. So it's a very silent disease. That's another unfortunate thing. So pain bhayo भने abdominal pain haru bhayo भने always go for an ultrasound, check if the gallbladder is okay or not. Gallbladder stone छ भने I think it's best to discuss with the surgeon who is around you and take an opinion. So gallstone lai ignore नगर्नु होला. So there is most of the cancer patients of gallbladder who come to us उनीहरु advanced stage मा हुन्छ. So they have some jaundice or they have some metastatic disease which has spread. So gallbladder cancers can be of two types mainly. So more than the stage, it's more important that gallbladder cancer, is it operable or is it not? So हामीले first when we suspect a gallbladder cancer, when we do a USG first ultrasound हुन्छ, ultrasound मा gallbladder मा केही त छ भनेर देखिन्छ हैन. So they actually suggest the next scan. So in our cancer hospital we generally do a PET CT scan or a CT scan of the abdomen, and then we see के यो gallbladder cancer त्यही gallbladder मै सीमित छ कि अरु ठाउँमा पनि फैलिएको छ. त्यो हेरेर हामीले स्टेज गर्छु कि whether the cancer can be operated upfront or we can wait, or we cannot operate at all. So there are three options. So first is upfront operable. Second is upfront operable छैन, तर we can give some form of therapy and try to decrease the cancer burden and then go for the operation. And third is which has widespread भनेको लाइक सबै यताउता लिभरहरुमा के त ओमेन्टम भन्ने पेटको एउटा आवरण हुन्छ, त्यहाँ सबै फैलिसकेको छ. त्यस्तो डिजिजलाई चाहिँ हामीले इनअपरेबल भन्छौँ directly. And so if it's upfront operable, the best option is to go for direct surgery. FNACहरु गर्नु हुँदैन, त्यतिखेर डाइरेक्ट सर्जरीमै जानुपर्छ. द सर्जरी इज नोन एज अ रेडिकल कोलेसिस्टेक्टमी. इट्स नट जस्ट ए कोलेसिस्टेक्टमीको अपरेसन जस्तो हैन. यसमा चाहिँ गल ब्ल्याडर सँगै लिभरको एउटा पोर्सन, वरिपरिको जुन ग्ल्यान्डहरु हुन्छ उनीहरुलाई लिएर एउटा ठूलो सर्जरी हो. सो रेडिकल कोलेसिस्टेक्टमी इज द ट्रिटमेन्ट अफ चोइस इन सच केसेस. सो दैट इज द बेस्ट ऑप्शन फर ऑपरेबल गल ब्ल्याडर क्यान्सर. जब यो गलब्ल्याडर क्यान्सर अलिक ठुलो हुन्छ, लाइक 7 सेन्टिमिटर 6 सेन्टिमिटर साइज अफ गलब्ल्याडर क्यान्सर, सो त्यसमा चाहिँ हामीले जेनरली वी गो फर ए न्यू एडजुभेन्ट केमोथेरापी एप्रोच, जसलाई दिएर हामी गलब्ल्याडर क्यान्सरलाई अलिक सानो पारेर देन वी ट्राई फर द सर्जरी. बट मेनी अ टाइम्स वी फेल टु डु सो बिकज गलब्ल्याडर क्यान्सर डजन्ट बिहेभ भेरी नाइसली अल द टाइम्स. एन्ड द मोस्ट unfortunately हामीले जब गलब्ल्याडर क्यान्सरको केसेसमा पेसेन्ट्स पाउँछु, मोस्ट अफ द पेसेन्ट्स आर विथ स्टेज 4 डिजिज एन्ड सबै फैलिसकेको छ. त्यसमा चाहिँ हामीले केमोथेरापी गर्छु. एन्ड केमोथेरापी दिएर यो गलब्ल्याडर क्यान्सरको सर्भाइभल इज नट द्याट गुड, and it's not a curable disease. It's around 1 to 1.5 years. Sometimes very lucky patients can go through 2 years. That's the median survival of stage 4 gallbladder cancers. अनि अहिले चाहिँ एउटा नयाँ कुरा आएको छ जुन that is we do give immunotherapy agents along with chemotherapy, जुनमा चाहिँ तपाईको अलिकति बेनिफिट देखेको छ. So the immunotherapy drug is called durvalumab, which is used along with the chemotherapy backbone in stage 4 gallbladder cancers. So I would just wish that we would be happy that we won't see any gallbladder cancers at all. So it's a very dreadful disease, it's a very painful disease, and I just wish that we could avoid it altogether. So I wish you a very happy and healthy life and a cancer-free life. Thank you so much. I'm Dr. Saptarshi Ghosh.